everybody, this is Tess with ROE Dental Lab, and today I want to talk with you about our full denture offerings. I know there's so many options out there when it comes to printed, milled, traditional. It's kind of like, when do I pick what? How do I go about selecting a patient for these cases? And today we're going to get into that. Please remember, we are a full-service dental lab, so we fabricate more than just dentures when it comes to your crown needs, partials, fixed full arch guards, and more. Now let's dive into full dentures. The first option I want to talk with you about is our digital dentures. Now, there's so many reasons to give digital dentures a try, but I kind of want to go over the highlights of them with you. And I will say, I know digital dentures feel like something that is on the horizon or has kind of been the talk of the town lately, but rest assured, we have been fabricating digital dentures for years. Our lab is one of the leading digital denture manufacturers in the country, and we have fabricated over 100,000 of them in the past few years. So rest assured, you're in good, experienced hands here at ROE. Digital dentures can be easily replicated, fabricated in just a few visits, save chair time, save costs. There's so many great reasons to give a digital denture a try. Whether you're digital or analog, you can be a candidate for these cases. Now, when would you be looking to do a digital denture as far as our impact options go, and why? So the great thing about these dentures is they can be fabricated very quickly if you have a patient who maybe threw a denture out, misplaced a denture, is looking for a backup denture for a trip they have coming up, or wants to replicate a denture. So those visits can be as short as just 2. If you're making your own bite block in office and then you send us the records, we can fabricate a final denture to send back to you. Or if you're not a huge fan of making a bite block in office and you'd like ROE to do that, we can absolutely get that done for you. Send those records into ROE, we'll return a bite block and then a final denture to you after the bite block's returned with the appropriate markings. So best case scenario, 2 visits, worst case 3. Now, for some of the skeptics out there, what if you get your final denture back and you want to make changes? We can do what's called a reverse reset, which we talk about in detail in some of our other denture videos, but we can make those changes through that reverse reset later. So don't feel like you went to a final denture in 2 visits and now you're locked into that denture. We can make changes later on. Another benefit to digital dentures is going to be the impact denture is made of 2 pieces. So we have the scallop denture base and the printed denture teeth, and they're luted together with a liquid form of the acrylic. So a great option that can be fabricated quickly for your patient looking to get into a final denture faster, no matter what the reason may be. Our digital dentures come in 2 options. We have our premium, which is a printed lucitone base with premium teeth, or our economy, which is a printed lucitone base with economy teeth. Let's transition over to another option in the digital denture wheelhouse, our Ivotion milled denture. So our Ivotion milled denture is a single puck that is milled out. So there's no adding single carded teeth like you would with a conventional denture, or even luting teeth on like you would with a printed denture. It is one solid piece. So as far as strength goes, it is a great option. The Ivotion is going to be a great aesthetic choice when you're looking to make a selection within that wheelhouse. It is also great for overdenture cases. And one huge benefit when we kind of drop back to the umbrella that these options both fit under when it comes to the digital denture universe is going to be our ability to make easy reprints. So patient loses a denture, misplaces it, dog gets a hold of it, you name it, you call ROE for a no impression reorder. We keep a digital footprint of these final digital dentures so that when your patient has an accident, we can just send you a new denture, no additional visits needed. Let's talk about now traditional dentures, because there's absolutely a space that exists for them. They've been around since the dawn of time. We all know and love them, and there is a place for them in the denture universe for sure. We all have those patients sometimes that every time they come into the chair, they're biting different. They want the midline move. They don't like the shade. They don't like the mold of the teeth. Any reason to make changes, it kind of feels like that's the way we have to go. And sometimes there are changes that you want to make and manipulate chair side in order to reflect to us at the lab. Resetting teeth, moving things around, moving the midline around, grinding down the bite. traditional dentures are still going to be a great option when it comes to customization with these patients. Now, we have two options when it comes to our traditional dentures. We have our premium, which is an Ivocap base and premium teeth, or our economy, which is again an Ivocap base and economy teeth. Either or are great options when it comes to your patients needing more customized cases. The last of these options is going to be our hypoallergenic dentures for your patients who may have an acrylic sensitivity. For these hypoallergenic dentures, we have two options. We have our premium, which is a Keradent denture base with premium teeth, or a Keradent denture base with economy teeth. Now, if you have a case in mind and you're not sure which of these options we talked about today is going to be best for you, please call into our lab directly. Our technicians are there to help walk you through records, questions you may have, materials, you name it. And please also don't forget, we are a full service lab here at ROE. So if you have a removables patient who's not quite ready for a denture but maybe a partial, please keep us in mind for your partial denture needs, and your crown needs, and your fixed full arch needs, since we do it all. Thank you so much for tuning in, and we look forward to doing your next full denture case with you.